Welcome to Unhinged and On Call. I'm Dr. Chelsea, your resident veterinarian.
And I'm Trish, a registered vet tech who's seen it all. Each week, we're pulling back the curtain on the wild world of veterinary medicine, from late-night emergencies to barnyard drama.
No filters, no fluff, just real stories, real laughs, and maybe a little emotional damage. Thanks for letting us share the madness with you. Thanks, everyone, for tuning in to Unhinged and On Call. We're so excited. We have two great guests today at the same time.
Yeah.
They're colloquial termed, and they came up with it, the double Ds.
Yeah.
So they're so great.
Yeah.
It's Dr. Diana Stolz and Dr. Diane Rhodes. They both work at Loomis Basin Equine Medical Center, and it's right outside of Sacramento in California. They're just like super dynamic, great equine practitioners.
So fun.
Dr. Rhodes is an internist, so she's in the clinic a lot. And then Dr. Stolba is ambulatory medicine. And they've been doing it for so long. And it just speaks volumes about the clinic because essentially as partners too, they have like numerous people, I think at least a minimum of 3 did equine internships there and then came back as associates or post-residency to work there. And you just don't, in equine medicine, I hate to say it, but you just don't hear that because internships are pretty grueling. And a lot of times it's a huge time of learning and development, but it also usually isn't a good fit long-term. So kudos to that whole practice.
They were just so refreshing to talk to. Just, they got along phenomenally, but you can tell that they truly just enjoy what they do. And that's so nice.
Yes.
So,
and it is refreshing.
They have a coffee shop in their clinic, which I love, but it's called Roni's. So if you're in the area, it's open to the public too. So you can
get
go
coffee
and get a cup of coffee.
And
say hi.
What a great idea.
Yeah.
So, stay tuned because we had a great talk with them.
This episode is brought to you by our friends at VetCS, your go-to for veterinarian-developed CBD and wellness products for pets and horses. Founded by veterinary professionals, VetCS offers science-backed formulas made with premium hemp extracts to support calm behavior, joint health, and overall wellness, whether you're in the clinic or out at the barn. VetCS is all about helping animals live better naturally. Want to see what they're all about? Head over to vetcs.com to explore their full line of CBD products.
Thanks, everyone, for joining us today. This is Unhinged and On Call. We have two great guests, actually out of California. They're both equine veterinarians, Drs. Diane Stolba and Diane Rhodes. So we're super excited to have you both today. This is probably our first time with 4 people in like 2 rooms.
Yeah.
Usually,
2 guests at once. It's our first time.
Yeah. We've had like remote guests, but we're so excited to have both of you. And here, let's first talk about Loomis Basin. That's your clinic. You guys are just north of Sacramento.
Yeah, absolutely.
Okay.
We originally started the clinic
1975.
No.
We weren't here.
Okay, right.
Just for the record.
Yeah, exactly.
Exactly. I was going to say, great.
So, yes. And so anyways, I did my internship in about 2009. She was 2010. We've definitely drank the Kool-Aid and have been, she went away and did her residency and came back.
Yep. I tried to leave and then
You got squeezed back in.
It's like an abusive relationship,
You just
really.
keep coming
You
back.
just like you crave it.
Yeah.
But yes, we're primarily equine practice, and the occasional small ruminants, that live in the pasture with the equines.
Oh, yeah.
As emotional support buddies.
Yeah. Thank you.
Yes, they need those. But yeah, and I think we really should talk about, in case anyone has this turned on, like why we are dressed the way we are dressed.
Because if you're watching on
really...
YouTube, there's some great costumes, and it is we're recording on Halloween week, so it's very appropriate. But you guys have Spirit Week this week, is that right?
Yeah, we have Spirit Week. So yesterday was Crazy Hair Day. Today is Tacky Tourist.
Yes,
I got my little
love it.
So as much this is not everyday attire.
Usually trying to be slightly more
professional.
Okay.
Just
sometimes bad things.
it's rough.
It's really
rough.
Yes. Yes.
Yeah, like my cat face. I'm like really trying to be like, I'm really sorry for your loss.
Yeah.
Don't think this is coming across as genuine.
Right.
Yeah.
But it's fun. Everybody should have fun with the
I
clinic.
know.
Yeah.
That's such a good morale booster for everybody, for sure. That's a great time.
It is, especially right now, right? It's like we have falls here. It's getting darker earlier. The fall funk sets in, right?
Yeah.
So you need something, and
Especially
this is
for us
perfect.
Californians, because we need sun.
We yes,
Yeah.
5 days a week, or
True.
we are grumpy.
yeah.
So
Chocolate helps. Chocolate helps.
Yeah.
Yeah.
Yes.
coffee.
That's
And
so
coffee.
true.
Yeah.
Yeah, and for all the
Chocolate
listeners with equine clinics, they actually have their own coffee shop within the clinic setting, and it's a beautiful clinic. I've looked at the pictures and all that; like it's gorgeous. So, and it's open to the public. Anybody can come in and get their coffee.
So cool.
Yes, exactly. Bronies. Yep.
That's a great idea for clients too, because you can just
Yes.
send them to go get coffee while you're doing
Yes.
some diagnostics. And
Exactly. And the nice thing is that, they can get coffee and it's in such high demand that even one of the other practice owners, he's basically a barista. So,
Yes.
so if you need a coffee,
And
on
Diane
demand,
herself has filled in.
I have filled in at the coffee shop.
You want more?
Ooh.
I-
sure you get your.
I did. There was a time where they needed to clock out for lunch.
Yeah.
State laws, we follow them. And so Langdon Fielding, one of the practice owners, was the barista. He just made sure when people came in that, hey, no complicated orders. And then I was running the cash register, and it wasn't our best day.
Well,
I got offered a warm up panini. I was basically fired from the job, but I tried really hard. My customer service was great in terms of my enthusiasm.
Yes.
Okay.
Enthusiasm
I
was
could
there.
see that, but you could stick to internal med.
Exactly. Sticks to internal medicine.
Yeah, exactly. Right.
Well, before vet med,
example.
I worked in a cafe, so breakfast service and stuff. So forever ago, but I could foam a mean latte. Like I'm good
It's
at
a skill.
at foam.
It's a skill. I wouldn't be able to.
Well,
Yeah.
you have a phone.
No.
Can you? Yes.
If I ever
foam
find
art.
myself out there,
Yeah.
we can do a foam off.
I would say that part of my retirement dream is to work in one of those coffee shops by the beach where people they want to see you because they're coming in because they want to see you. So
Yes.
if it happens, I'll reach out in the future.
Okay.
Let me.
I'll need a good foamer.
Yeah.
I got you, girl. I got you.
On the beach.
On the beach
together.
foaming.
Yeah. I love it.
That's so funny. Oh my gosh.
Well, I have to say, I mean, I think most people understand listening to this podcast, understand equine medicine, but I think it's quite rare for most intern graduates to come back to the same clinic. Because I have a lot of colleagues that you do your internship and then you're either moving back home or yes, you get advanced training. But it says a lot about a clinic that their interns come back.
Yeah.
That's huge because internship can be really difficult. So
Yeah.
So kudos to the whole practice.
Yeah.
The culture is good.
Well, and Diana Stolba was a lone intern.
I was the last intern who was all by
Oh
myself.
my gosh.
It was
Uphill
both ways.
Yeah.
Yes.
It all the time. So when I was the following year and I had an intern mate
Okay.
who also is at the practice still.
Whoa.
Yeah, like a lot of our.
Wow.
You get more than just the three of you?
Yeah.
Oh,
Yeah.
that's incredible.
But again, she'll let you know it was uphill both ways almost
Yeah,
at
exactly.
1,000 feet of elevation.
Yeah.
Not
Yes.
even.
So great, and then you're like, I don't actually love her.
Bit of a self-proclaimed spaz.
Yeah, she
I
is a
own
spaz.
it. I
Well,
own
we
it.
all know that first few weeks of your internship.
Well, yeah.
Yeah.
You're barely staying afloat.
And I'm a rule follower.
Okay.
I'm a rule follower.
good
It stresses me to this day to
That's
not
why she's the
follow
hospital
rules.
director.
That's why I
Rule
manage
follower.
I'm the medical director now because I'm
Okay.
a rule follower. However, when I first started at the clinic, again, it was 6 months and everyone's like, was it even that? No, it wasn't
No.
that long.
So we
It
went
wasn't
to
that long.
AAP
We went to AAP
together,
together.
and
And
that's when we bonded.
it's great
Oh.
because that's time for interns to let loose and learn something.
Yeah.
I was there
Totally.
to learn.
Yeah.
She was there.
I was there
learn.
to learn.
and I had to teach her how to actually conference.
And so, yes, she had to teach me how to conference. And so we were actually sharing with some friends of ours. Well,
there was also another associate and
Intern.
from another practice.
yes,
Okay.
and
4 of us in a room.
the 4 of us in a room. We had to share a sleep number bed.
Yes, sleep number bed.
A
That's
single
how
bed?
you know
No, like a
it
sleep
was sleep number, so it had different
So you
sides.
can pump it
Oh.
up, you know,
Oh, it moves.
Yeah.
like the air,
Yeah.
like
That's
air
good.
pressure changes. So that basically means for 2 people, 2 adults in one of those, you're either convex or concave.
Yeah.
There's really no.
We taco.
Yeah, exactly.
You had to get close.
You were like, it was like the
That's
worst
awesome.
thing I've ever been ever.
Yes.
And so, I mean, so
Yeah.
you're in theory, because you can each change your side to how firm you want the bed,
Yeah.
but it just didn't work out that
No.
way. So we just kept tacoing,
Yeah.
and
like a limp air mattress.
exactly.
Yes, just like an air mattress.
Yeah.
So that's what we were forced to be close. And
Yeah.
then of course, this is AEP. I'm ready to learn. It is 7 a.m. session.
Yeah.
I've got my bag. I'm
Yeah.
ready to go. And she's all, what are you? No,
Sit back down.
Yeah.
down.
You don't go to the first session.
No,
You
we're
don't-
getting Bloody Marys in about an hour and a half.
Yeah.
And then we're going.
And then we go. And I'm like, oh, okay. Okay. There's learning happening.
Yes.
It's okay. But it's fine. And I did learn how to conference.
Okay. Okay.
I have adapted.
Yeah.
I'm okay with
Yeah.
the proper way
You
to
go to the
conference.
conference, you learn all the things, and you
And you also socialize.
Are you
Yeah.
going to be at AAP in Denver this year?
We
Yes.
will be.
Yay! You'll see us. We'll have
Yeah.
a table, so you'll have to come
Yes.
say hi.
Oh, absolutely.
Oh, absolutely.
We might not wear a Hawaiian outfit.
Right. You
Oh,
might
Yes.
not recognize you.
Yeah, I won't know. I won't have any idea who you are without your binoculars.
That's fantastic.
And I'll only see like half of your face because that's what I can see. On
Well,
the
right.
screen.
Oh, I know. Yes.
There we go.
Yeah.
Yeah.
Oh, you gotta love the audio visual.
I know.
We're not pros at that part.
No.
There's no equipment today, people.
Yeah. Yeah.
There's a reason we sound
Technical
different.
Yeah.
difficulty.
Veterinary medicine and
Morning.
technology don't necessarily go together usually.
Right.
Yeah.
We do a lot of sort of journal club with like some of the folks who don't come into the clinic, and we have a conference room, and every single time we set it up, it's like an introduction into technology, and I can never figure it out. If I'm in charge, I'm basically like just calling people on my phone
Yeah.
as the speaker because
Yeah.
I can't figure out the room. So technology, I just want it to work.
Yeah.
I don't want to have to learn how to use it. I just expect it to be that self-explanatory.
Yes. It's
By
it's
now,
2025.
Like
Like,
AI. Come on.
Yeah, exactly. Do it for me.
Yeah.
Sorry.
Just push a button.
Do
One
it.
button.
Yeah.
Oh
That's
my gosh.
fantastic. Well, tell me, we heard rumors about a cow story, I
Yeah.
guess, that you guys were
Well,
involved in.
So this actually is a story that goes back to when Diane was an intern with her intern mate, and I was back in the day, and I was a first year associate. And this was a time when our clinic was smaller, and so we had like one big doctor's office where I actually had time to sit there at that point, which I haven't sat at a desk in years, but so it was one of those. The front office person comes back and says, "I have someone on the phone with a cow emergency. Can you take it?" And then everyone kind of, touches their nose.
Touches their nose.
Says,
Yes.
"Yes, this is Loomis Basin Equine Medical Center.
Not it.
Like
You missed
We don't.
you missed the species.
the
Yeah.
bovine. Yeah, you missed the bovine. Yes. So I was dubbed the grown up in that situation.
She lost the competition.
Yes.
You
Short
lost.
straw.
Yeah.
Short straw. So I picked up the phone and thought what I had was a very intellectual conversation for my knowledge of bovine.
Which was basically to back up the lady on the phone. It wasn't even her cow. She was going by the field and noticed the cow was down, and she was emotionally distraught.
on the
She
phone.
had become connected.
So
to
it was
this
like
cow.
along the road,
a road.
and she had like gone through the fence and was next to my cow.
It was almost like her voice was shaking, like she was tearful.
Not her.
Yeah.
Okay.
phone.
Not her
Okay.
cow.
Not her cow. Not her cow.
Okay.
Not her cow.
Okay.
But this is that Californian hospitality.
Yeah.
Yeah.
That people know so much about.
Yeah.
We're so known for it. But anyway, this lady, okay, she was probably a hippie, whatever.
Yeah,
But anyway,
exactly.
so she's like distraught about this cow. She's like, I think it might be dead. And so we're sitting there, myself and my intern mate, just looking at the good Dr. Stolba, looking up to her, this person,
Yeah.
this authority, this whole associate year ahead of
Yes,
us,
yes.
wondering, what is she going to say to this poor woman? What'd you tell her to do, Stolba?
Well, I said, can you access its head or face? And she said yes, in between her sobbing. And I said, like, okay, is there any way you can gently, carefully
Poke it in the
poke it
eye.
in the eyeball?
and see if it moves.
I love
So
that.
she literally
She
this is
told
what
her.
we learn in veterinary medicine.
Yeah, it is. It's super important. The corneal reflex.
Like, you're not leaving the farm if you euthanize something before you poke it in the eyeball.
Correct. I don't leave it. Yeah. Yeah.
Straightforward, easy instructions.
I love it.
Yeah.
Yeah, exactly. Stethoscope for show, listening to things, that's all for show. But really,
Yes.
you're going to poke it in the eyeball.
Yes.
True test.
Corneal reflex. That's
Exactly.
what we want.
So she poked it, it didn't move. And then I took a moment and I said, I'm sorry for your loss.
Okay.
I think the cow has passed.
Awkwardly hung up.
And then I hung up.
Goodbye.
Like, meantime, the rest of us are trying not to die laughing in the back.
Yeah.
Well, yeah. Sorry for your loss.
Right? That's as gentle as you could be.
I mean,
Goodbye.
goodbye.
Yeah. Yeah.
You could have told her to
so-
lay on the chest and just like listen for a heartbeat. But I like.
What if the cow woke up?
Well, yeah, I like the corneal. I think it's
Yeah.
perfect.
You know, she
Fast,
could've been-
easy. Yeah.
Pretty much any
And
cow
also
laying
not-
on the line.
Best.
Yeah.
This cow is at its best.
Yeah.
Yes.
Yeah.
Yes.
Yeah.
I feel like I really learned a lot about cranial nerves that day.
Yeah.
I love it. That's amazing.
But it's
That's
fantastic.
Just an accessory.
I think people, I don't know if you get this very often. I think people in vet med, or sorry, outside of vet med,
You don't know
not
that.
understand how many calls you get with people verifying that animals
Oh,
are
yeah.
dead.
Mhm.
Like,
Mhm.
I don't
Yeah.
know if there's some common sense thing that doesn't happen with people,
Yeah.
but they'll like, the animals will be cold and they're like, I think we might be able to save them. And you're like, no, this,
Yeah.
No,
this has
we
been a
had
long
It's
time.
been there a couple days. It's pretty
send
dead.
a picture
Before
because
it's small.
I'm not
Yeah.
sending someone out there to verify because they found it in the morning and it was a horse, and they were just like, it's not our animal. I think we need to make sure it's dead. And so we obviously have a lot of nosy neighbors or
Yeah.
busybody because this was again not the owner.
Okay.
Yeah, and they're I think it's dead. As its like legs, I was like, are sticking straight
Straight
out. I was
out.
like, I don't think we're gonna save this one.
Yeah.
So
Not today.
I agree. There's some common sense that maybe they just never grew up with any animals.
Yeah.
So
totally.
when you like when we've told this story before, people don't understand the corneal reflex. Like they
Oh.
don't, you know, that's not something that's common
Yeah,
knowledge,
That's
right?
true.
I mean,
Yeah.
you know, in Grey's Anatomy, they don't do.
Yeah.
it.
No, all the eyes are open.
Yeah.
Or closed. No, they close them. There.
Yeah.
That's what always gets me on shows is
They
they're never
close them.
closed. Yeah.
They like get
Yeah, you know what?
Sabotage.
And then they,
Closed.
and then they
No,
say,
if you try to close them on a horse, they don't close.
They
It's
don't
not
pop
like
back up.
you can't just wipe them down casually.
yeah,
Yeah.
yes.
There's nothing. I mean, you try. So, I mean, honestly, it's like the worst are when you have like kids or teenagers present. It is the worst. You're just trying to make something as like
Yeah, peaceful
as
and
possible. You're just
relaxing.
there's
like,
yeah
Yeah, there's nothing to.
yeah
I had a-
respectful. That is hard.
I had well, she's double boarded sports med, and surgery, but a professor at CSU. In her private practice days, she had a client pay her to suture the eyelids closed after you.
Oh wow,
Because-
that actually doesn't surprise me, to be honest.
No, but I've never done it. Like I've never had anybody ask, but that
I can tell.
would not
think I
know
secretly.
the eye.
The eye
being
don't
open.
use- Yeah.
So she paid her to suture them.
That's wild.
Wow,
I don't know.
that's wild.
Yeah. That was a long time ago, but
Yeah, I mean, there's a lot of things in veterinary that we get asked on the daily that are not things that you would ever expect you would be asked.
yeah,
Yeah, very true.
write them down because you kind of forget. I like sometimes trauma block them, and I'm like,
Yeah.
oh, that didn't
Like,
really
oh,
happen.
that did
That
happen.
didn't happen.
Yeah. Yeah, we were talking about that with this, and I was saying, like, literally, my short-term memory loss is what makes me show up to work so happy and so excited every single day, and I can forget the things that are like, wow, that was a rough day, or that was
Yeah.
a, you know, and you show up happy to do it again.
Yeah,
And I think that sometimes is really helpful. So yeah, when we were trying to think of stories, you have to kind of sit down and really ruminate on them.
It's
Yeah.
funny. I saw we reminded each other of
We did. I think
stories
we couldn't think of our own stories
Oh,
together.
funny.
We just had to like get on the phone. Like, we had several sessions of just like driving home from work on the phone together and just like bringing up memories, about each other. Like, did you remember when this happened to you? Oh yeah.
Yeah. We've literally done that same thing.
Yeah.
Or been like, oh, remember when that happened to you? But you don't remember your own.
Like, no.
Like,
Yeah.
I
No.
think you start to think it's like normal.
Yeah. Yeah.
Oh God.
So
everybody
true.
does this.
Yeah.
Everybody does this.
Yeah. I love that.
What others did you guys have that you came up with?
One was a mutual client that is just a client of the practice that, honestly, this is one I had forgotten as well. But when Diane started mentioning it, I was like, oh my God, that woman is certifiable. And I had a story, so I'll let you tell yours.
So I think it's one of those things, right? Like depending on, at least for us, the phone, it populates like the phone number and then obviously a name if possible. So you know when the phones ring, then everyone is just like, I'm not gonna
Sitting back.
Everyone's sitting back like someone else is gonna get it. This client is that person, right? You're just like, someone else will answer it.
Some new person doesn't recognize
Someone
that
else
name.
Yeah, they'll
Yeah.
be the sucker
Yeah.
that answers. Yeah.
Anyway, so she's famous because she's a bit of a nutter butter.
Okay.
And so basically, I was called out to go see her horse. She was really worried that it was dying. And she was like, make sure you bring gloves. And I was like, that's standard operating procedure for us, lady. Like we wear gloves before patients, infectious diseases, anywho. And so I get out there and she's like, park your truck here. And I was like, oh, okay. Park over here. She's like, do you have gloves? And I was like, yes. She's like, do you have a mask? And I was like, this is pre-COVID.
Yeah.
I was like, no, but I mean, she's like, and she's visibly upset. She's like, well, the problem is there's a fungus. And I'm just looking around like, okay, I mean, we are outdoors. There's
a lot of fungi around us.
Horse, because I think my horse is dying because of a fungus. And so I said, well, let's check your horse out. And she says, I should also warn you, I have the fungus too. And I'm looking at her and she looks otherwise healthy. And she's like, it's in my nose and in my sinuses. The doctors say it's in my lungs. I am dying. And I was just like, I'm really sorry to hear that.
She was dying.
Go look at your horse
She was
now.
dying.
So we get to the horse. The horse is BAR, normal vitals, bleeding. Just there's no weight loss.
No
The
visible
horse-
fungus.
No visible fungus. And she's pointing to her face and she's like, do you see it? Do you see it? And I'm looking, I mean, there's not even alopecia on his face. I mean, there's some
Not even
dust.
some rain rocks.
No,
Like,
there's some dust. But I'm looking at her and it's sort of like, what is that book? The Emperor's New Clothes?
Yeah.
Where I'm just sort of like, am I on camera?
Yeah. What's happening?
Where's
What am I
acupuncture punking me?
How do I treat this? And I don't know what to do. So I sort of said, let's do some medicated baths because that's pretty benign.
Yeah.
And I told her she could, wipe its face down with some, medicated shampoo, so to speak. But she was convinced. And then she apparently she ended up having me call her small animal vet because her dog also had the fungus. And so then I had the whole hour-long conversation about like, at what point do you call and seek an intervention for this
Right.
lady who is
Correct.
with the small animal veterinarian?
with the small animal. Like we're shooting the shit because the small animal
Let's just
veterinarian
pretend we're going to talk
also
about this.
exactly. The small animal veterinarian also has horses, and we're just shooting the shit. But like, I mean, did you think you were on candid camera? Like, so she's nuts.
Yeah.
She's nuts.
Wow.
So
How did she get over it?
You
Like what?
I don't think she's still alive.
She
for the
hasn't
record.
died.
Okay. Okay.
she
Good.
didn't die.
Good.
No fungus. And in fact, I was with we had a couple of years ago, we had an intern and she had a horse that had a laceration and I had just had knee surgery. And so
as we do, she's out there on
so as we do,
crutches,
so
like,
I'm like, well, you know what? I can't even drive at this point. So I was like,
I told the intern, I was like, hey, you're going to drive the truck, and this is your perfect opportunity to be able to do all the hands-on things with an adult supervising. So I was like, I had my computer. I'm like, I'll do all the billing and all those things, and you'll basically have to do everything, and I'm just your backup. So he drove us there, and I'm just sitting in the back seat of the truck. You know, we took all the equipment out so I could, with my legs sideways, basically. As he was like, okay, these are the x-rays, and he'd bring me the computer so I could look. And then he's like, and I was like, okay, what do you want to do? And he went through the whole plan because I couldn't do anything, but she didn't bring up the fungus at that time.
Right.
So
Sure.
I feel like I would like whip out an auger plate and like swab the fungus, and I'll be like, let me take this back to our lab. And then you call it, like, ma'am, thank goodness. This is not deadly, and it only grows and just makes it grows on like bananas. You can never eat bananas again. But
I know. I love that because you were getting on her level. And that's kind of what you have to do with those
That's
people.
true.
Yeah.
I did not have that foresight at the time. I was just like,
I saw her before the fungus.
Okay.
And I had been out there multiple times for a worm in an eye on the horse. And she was convinced there was a worm in her horse's eye. And every time I'd go out there, I couldn't catch the worm. I mean, I couldn't see it. It's not a bottle of mezcal. Yeah, exactly. I would do a very thorough ophthalmic exam, sedate, block the whole number. I couldn't find anything wrong with the eye. And so I was like, you have a phone. Yes. Okay. It has a camera. Yes. Okay. So next time you see the worm, I would like a picture, right? I would like a picture of the worm or video, and we can screenshot it, but I would like to, so I can, document this. Yeah. And so the next time I go out, I get a call. Yes, she has a picture come out. I get out there. I'm not joking. She literally, with a number 2 pencil, had drawn on a piece of paper a circle with a squiggle. That was cool. He was like,
diagram.
He was like, this is the eye, and here's the worm.
Just trust me.
And I was like, no, I wanted a picture. She's like, I saw it with my own eyes.
it's like she saw the fungus.
So
just like the fungus. She has great eyes.
Exactly as good as a picture.
Her eyes are way better than ours.
You got getting on her level, be like, ma'am, stand back. And then you can just be like, I got it. I've disposed of it. It's gone. I got it. It's gone.
Let me go dip it in some formalin so I can
make sure it's good now.
Yeah.
Oh,
See, we learned something.
I know.
This is full,
It's is this a CE meeting?
Indeed, guys, how to troubleshoot weird people.
Yeah.
I hope
not when to refer, but when to consult with others. Community clients.
Yeah.
Trish, you got the whole the whole bag of tricks.
I know. Just dealt with too many weird people in my life. And honestly, like outside of vet med in the restaurant industry before too. I've just interacted with many different types in my life.
True.
Oh my goodness. So funny.
I hope she didn't have kids. I feel like she would probably be crazy.
She had the dog that had the fungus.
Okay.
And I only ever saw a dog and a few cats and then the horse.
Okay.
Yeah. So I think, and she lived sort of isolated on a hill. So
that's good for her and everybody else.
And the neighbors.
Yeah, but it is every time she calls, it's a bit of a Rochambeau.
Yeah.
It's going to draw the short end of the stick. And it's like, now it's like, I would for sure pull rank.
Oh yeah.
Yeah.
I don't do that. Yeah. I try not to do that.
No,
oh my gosh.
No. I always think though, what happens when there is a bad thing, like when it's a severe colic or something? Like, you're gonna have.
I have been out there. No, I have been out there, and I did have to euthanize my horse.
You did.
At some point. Yeah, it was a really bad colic, and so it was. It's like we have to go, right?
Yeah,
It is our job and our duty to go, and we joke about the times that it's like there's literally nothing wrong, but every once in a while
There
actually is.
Yeah,
so
totally.
Oh, wow.
Yeah.
That's
Who knew we'd have to be like psychiatrists?
I know.
Oh,
I think that's part of that. That is the thing that, you're like, I'm going to go to vet school to learn about animals. And, and they, how they're starting to introduce like business concepts and stuff into school. The, the psychology part
really needs to,
that still needs to be augmented.
Yeah.
Yes.
We were talking about this not too long ago, because it's like people in their vulnerable state right? Around their animals being unwell, whether it's fungus or colic, but that they just like are in that state of mind where they just want to like dump their lives on
the rest of
the things that they share with us is always like shocking. I mean, I know so much about these people that I never asked.
Well, yeah,
right.
Like, and it's just divulged to you. Like
one of our associates was at a call recently where she was, just out there, I think had a summer sore and it's like urethra, and she was just doing a willy wash. And
sure, as we do with all our degrees.
Yeah. She's holding the horse and the lady's like, yeah, I think I'm going to leave my husband. And she's just watching her. I'm sorry, what? So literally, it's just like, you never know what people are going to share. Especially when you're in
Yeah.
Right.
I'm going to leave my husband.
Oh my goodness.
I love that.
Yeah, what do you say? What do you say?
Yeah,
about
what do you do? Just be like, I usually just default to, I'm so sorry.
Yeah,
she just kept washing the willy.
Keep doing your
yeah, but it becomes challenging when you get invested, and then the next time you go out there, the husband beats you, and then you're like the whole time in your head thinking like, well, did she try to leave you? Did she not?
Or is it the new husband?
Or is it the new husband? You can't remember.
Yeah.
There's
a lot.
There's definitely a lot. We've had that, we have that dynamic, unfortunately, where there's a whole other thing going on in your mind and you're just like professional face.
Yep.
Talking about the horse.
Yeah.
Not professional.
Speaking of willy washes, though, we did have a client a couple of years ago write a song about sheath cleaning.
Oh,
we should send it to
Yeah,
you.
do you know it?
Yeah, we didn't memorize it as like a clinic choir.
not become.
We should have,
but
play in the background.
sometimes you get really like nuggets like this. She composed this song.
Yeah.
Wow.
That's really washing.
That's a lot of effort, actually.
Was there an instrument involved or just voice?
No, it's just voice because it's to the
good question.
I can't remember now. I have to look it up. See that bad memories.
Yeah.
Hopefully a ukulele was an instrument of choice.
I mean, go with our outfits today.
Yes, it would. Yeah.
Yes.
See.
You didn't say prepare a song.
Yes, you did not say.
I didn't warm up my voice.
Oh, yeah, we can't. Yeah,
can't put you on.
And we need better equipment for that.
Yeah.
Absolutely. That I would blame your equipment for my voice.
Oh, microphone's not working.
It's just not working.
Yeah.
It's off tone.
God. I love it. Oh my God.
Oh wow.
I feel like we would all work together very well.
Yeah. I guess we need to come to your clinic.
I know.
Yeah.
Yeah, we'd love to have you guys.
Yeah.
So fun.
So are you on time veterinarians? Or
this is a great question.
Are we
timing?
On time? What do you mean?
Are you on time veterinarians or tardy?
Oh, always late. Always.
She looks at me. Nobody can see that, but there was like a look and a There was like that was given to one of the double D's.
Okay. So Rhodes, you're on time all the time.
I'm the ambulatory veterinarian.
I'm on time.
She's on.
I could see that.
Yeah. Okay.
Okay.
Yeah. First of all, they come to you.
Yes, Stolba, I'm with you. I'm ambulatory.
I'm
never on time.
Yeah.
You can predict the traffic.
I am always late to my first appointment and mostly on time and sometimes early to the rest of the day.
Whoa.
Unless there's emergencies, obviously, and then it gets out of my control. But usually I have been by my clients told that I'm a very timely ambulatory veterinarian. And if not, I do try to respect them and text them or call just so that. But yes, when meeting people in the real world, I'm always late.
Yeah,
it's remarkable because I'm a multitasker, and there's always there's always one more thing you can get done
for sure. If there's any amount of time, like 30 seconds, I'm like, ooh, I can do one more thing.
That. Yeah.
Well, I can. It turns out. And also, I'm physically uncomfortable if I am the first person.
Me too.
Or I arrive early.
Yeah.
I'm very uncomfortable.
Yeah.
Like very. Yeah.
So anxiety kicks in, and I'm like, what do I do?
What do you do? You stand there?
Yeah.
And wait?
Yes. Yes. But I could have done laundry before I left the house, right? Like
really.
Yeah. So many more things.
No, I like to shoot to be on time. like I enjoy my mental checklist, right?
Yeah.
But then I have an ADHD husband that's like, oh, I gotta go to the bathroom. And I'm like, dude, no. Why? Why is it then before we leave the house? All of a sudden. So then I like panic sets in, you know? So I do try, but then I'm late.
Yeah.
So
Yeah. She is remarkably good at she'll show up sometimes late to the first one. She is remarkably good at getting caught up with her appointments.
That's actually really impressive.
Because finishing work, she's really good at.
I'm really good at finishing.
She's really good at finishing work. But everything else, don't ever ride to the airport with
you and me.
Yeah.
We're gonna get along.
Exactly.
I like to never sit at the airport. I want to walk out.
No sitting.
Is getting called, and I want to just walk on.
No, I'll be there like 2 hours before. Then I'll be sitting there.
Thanks.
Yeah, and I'll have my breakfast and my drink and just the peace of mind that I'm not missing that plane. You know, and Chelsea's like, I'll be fine.
No. Every time I am there just a little bit early, they delay the flight. And I'm like,
yes,
I could have done so much more.
Yes, so many more things. You could have done it all.
No, see,
yeah.
This is so now.
We don't travel together.
If we go to the airport, I pick up.
Yeah, she will pick me
and
up.
I will show up
like 3 hours before the flight.
Whoa!
Yes,
God,
3 hours is the time before the flight.
No,
it's 3 hours before the flight.
Yeah,
people watching is good, I guess, but
it is.
Yeah, I don't know.
Do you guys, or have you ever played Your Team? That game, Your Team, in public?
No.
Is this like when you pick the equine vet out of the crowd? It's like, that's really easy to do.
Well, it's more just like public. So it's great at airports, phenomenal at airports. So if we're sitting next to each other and I just see like an interesting person, I just tap Chelsea and be like, she's on your team.
Your team.
And then you're out, you know, the rest of your trip. And if she sees someone, you know, and you have to get each other to it. Like, oh, that's on your team.
Yeah. We have a different phrase for when we see something that is just someone who is out there and you're just like, wow, and you really just want to stare really hard and you can't just be like pointing your finger, jumping up and down. We say IPG, which stands for in the presence of greatness.
In the presence. So if you hear IPG, then you know to just scan the horizon.
I'm stealing that. I love
find
it.
the person.
IPG.
In the presence of greatness.
I love that.
IPG. That is amazing.
IPG, you could make it all.
IPG 6 o'clock.
But we did a studio in January. We're playing that game.
I love that. Yeah,
that's a good game.
IPG. I love an acronym.
Yeah.
Might steal that.
Yeah. Look at that person running to their gate.
Exactly. With their Starbucks.
Yeah. That's a ticket.
You wouldn't get it because you'd already be on the plane seated with your
they wouldn't even.
Yeah, I'm prepared. It's my flight. I'm on the way. I got my blankie already from the lady. I'm like cuddled in my seat.
Oh my God. I've only missed one flight because of that. And it was Erin. Do you guys know Erin Cantino at CSU? She's a sports medicine veterinarian. She's fantastic. But this was before vet school, I think, because we've been friends for a long time. We didn't realize that we were both like Stolba and I. It's neither of us woke up to our alarms, and we completely freaking missed our flight to Rolex, like Land Rover. And both of us did not wake, like in separate houses, did not wake up or call each other.
Oh my
God. And it turns out we are both that way, where we're like, we'll push it to the last second possible.
Yeah.
And we did get on a flight that day, and we still got to see all of Rolex, but it was like it was a bit stressful. So I've gotten better. I do see speckles of why you would be on time.
Yeah, that you make it to your
I almost missed like getting to Rolex.
Oh my gosh,
that's a big deal.
I think it's best. Yeah, it's best that we pair ourselves with people that are not on our team.
Correct. And that is
so that we do eventually show up to the event. I mean, we might be being dragged and we might be grumpy about it.
Correct.
But we made the event.
You might need like treats.
You need a buddy system.
Yeah,
a buddy system.
Yeah.
That works best.
Then it's
support.
Yeah.
Oh, my husband, yes, he will be 3 hours. Be late. Also
okay. My husband is the opposite. So we did pair up with people that keep us on.
There has to be opposites. Yeah.
No, he'll like triple check everything like 50 million times before. He travels a lot for work and like international stuff too. So he's always like passport, ID, like making sure, like looking through all of his stuff a million times before he leaves the house. It's like
and then can't find his keys.
And then can't find his car keys. Yeah. Like,
and then he had to go to the bathroom.
Yeah. And go to the bathroom. Yes. It is so crazy because it's like both, he makes it where he needs to go eventually.
Both wallet keys.
Yeah.
There's a song by Adam Sandler. You should look it up. It's great.
It was actually our wedding vows that I had to help him find his car keys every morning.
Hers too.
Yeah. Really?
Except, he's in charge of my phone walleting.
Oh, yes. I love it.
And then when
I travel, I assume that responsibility. I have to return her with her phone wallet and keys.
I love it.
Yeah. We have recruited students, and I am returning her with her phone wallet and keys.
Exactly. Like I'm responsible. Because if not, you'll be like, at some concert dancing in Tahoe, and over the loudspeaker is like, I have Diane Rhodes' wallet.
Diane Rhodes in the crowd.
Yeah. Oh, yeah. It's like, oh yeah.
That's me.
Standard. That's awesome. I love that. Oh my gosh. That's incredible.
So
well, thank you both so much for your time today. I'm sure you have patients to get to, so we won't. But
a day of dentals.
I got a day of dentals.
You do.
I'm ready.
Okay. Is the weather still warm with you guys?
Yeah. 70s.
Oh
today.
Yeah.
Okay. Yeah, we're gonna come out there.
Cold. Yeah.
You can totally come out here. And then if you're at AEP, we should see each other.
Yes, that'd be amazing. That'd
I'll make
so
sure
fun.
I'll make sure we connect.
Yeah.
That'd be great.
Yes. Awesome.
Okay.
Well,
thank you so much.
Bye.
Have a good day. Stay safe.
Thanks for listening, everybody. We would really love to have you as a guest on our podcast. So if you have any fun stories to share with us or would like to be a guest, we have a form on our website. So unhinged and oncall.com. And you just click on the little link there and you can fill out a little bit about your story and yourself, and then we would get back to you. Or you can just email us to chat@unhingedandoncall.com and just tell us a little bit about yourself. And we would love to have you as a guest.
We also are looking for ratings. So essentially on Apple, Spotify, wherever you get your podcasts, you can rate and review our show. And that would be super helpful in just getting kind of into the algorithm. And then additionally, we are on YouTube. So if you ever want to watch videos, we put more content, like visual content, so pictures, videos, things like that, into the episodes. So we'd love to have you follow or subscribe our channels on YouTube.
Yeah.
Thanks for listening.
Thank you. Thank you for tuning in. Make sure you subscribe and follow us for all the latest updates. Unhinged and On Call isn't just a podcast. It's a lifeline for every veterinary professional barely holding it together with vet rap and caffeine. Somewhere out there, another tech, vet, or assistant is deep in the same chaos, dodging poop, managing meltdowns, and wondering if they're the only one unraveling. You're not. Whether you're laughing or crying or rage cleaning your truck, you've got a whole tribe behind you. You're unhinged, but never alone.